Hello everyone, we are on day 80 of the 90-day free NCLEX review series. We are also inviting you to enroll to our NCLEX review at stankosnclexcoaching.com. And today we'll continue tackling Q&As on the gastrointestinal disorders. Let's get started. Now, we have our first scenario here. This is a bow tie question. And the scenario states here, a nurse is assigned to a recently admitted 49-year-old client and reviews the emergency department notes to prepare care plan. Now we have the nurse's notes here. It states at 12 noon, client admitted to the ED with spouse reporting sharp abdominal pain in the right upper quadrant that has persisted for 3 days. The client also reports a decreased appetite, nausea, and a low-grade fever. Past medical history includes cholecystitis, gastroesophageal reflux disease, pneumonia, and type 1 diabetes mellitus. Now, your task here is to identify one possible condition the client may be experiencing, 2 nursing interventions to address the condition, and 2 parameters to monitor for assessing the client's progress. Now, I really want you to pay attention to the nurse's notes. This is the only base for our bow tie question. Now, you really need to look into the different options here. We have the potential condition. We have the nursing action options on the left side, and we also have the parameter to monitor on the right side. So I really want you to focus into first, identify the condition that this patient probably is having. Now, what you're going to do here is to really focus first into answering the middle section, which is the central well. And in this case, your task here is to identify the client's condition based on the nurse's notes. Now, I want you to focus into here, okay, into the nurse's notes with regards to the medical history and the manifestations the patient is having or they're having. Now, what you need to do here is to look into the details. We have to look into the abdominal pain that's described, which could fit several conditions, but you need to look into the location, which is specified here. It's stated that it's in the right upper quadrant, which strongly suggests that the patient has cholecystitis, as this area corresponds to the gallbladder. And you have the following options here: gastrointestinal bleeding, DKA, bacterial pneumonia, and acute cholecystitis. So with the other symptoms like decreased appetite, nausea, they don't really help narrow down the condition since they're non-specific. However, we have the low-grade fever, which could indicate the acute cholecystitis or could be bacterial pneumonia. And focusing into the medical history of our patient, the history of choledocholithiasis, this increases the patient's risk for acute cholecystitis. And while the gastroesophageal reflux disease may also raise the possibility of gastrointestinal bleeding, it is less relevant in this scenario. Now, we also have the history of pneumonia, and type 1 diabetes can also increase the risks for bacterial pneumonia and diabetic ketoacidosis. But ultimately, the acute cholecystitis is the most likely condition based on these details. All right, so that should have displayed first the potential condition. So that should be the acute cholecystitis. Now let's go into the part 2, which is to determine the nursing action. So we're going to have to select those appropriate nursing actions, and you already have seen the administer analgesic and start IV fluids. We know that with acute cholecystitis, pain management is very important. And so that would be one of the key interventions that you should provide to your patient. Another is starting IV fluids, because we know that hydration is really important, especially that we're going to place this patient on NPO status. So this is an appropriate action. Now, looking back into the nurse's notes, diabetes as part of the medical history, there is no indication that we're going to have to administer the IV regular insulin, because this is something that we're going to reserve for the management of diabetic ketoacidosis, and we don't have that as a concern for this case. Now, there's no evidence about a low oxygenation, and so this is not going to be necessary. The administration of O2 via simple mask will not be needed around this time, and there is no data in the scenario that can support the need for the insertion of an indwelling urinary catheter. So that's why we only have the two. Okay, administer analgesic and start IV fluids. Now let's get into the third section here, which are the parameters to monitor. Now, after you select the nursing actions, the final step here is to determine the parameters that should be monitored. So you need to select those that will directly address the condition or the intervention. So what do you think would be the answers here? So you need to supply about 2 of them. So the first is liver function test. This is going to provide information about the liver involvement, which is connected to the gallbladder issue. And the other one is the ultrasound result. This is critical because this can confirm the diagnosis of acute cholecystitis. However, if you had selected hemoglobin level, this is not relevant for acute cholecystitis, but this is something that might be useful in cases such as gastrointestinal bleeding scenarios. Now, if you selected monitoring blood glucose or blood glucose level, we know that the patient has a history of type 1 diabetes mellitus, but in the case scenario, it didn't say any evidence that there is a case of hypoglycemia, or let's say the patient is showing signs of hyperglycemia. So this is also not directly associated with acute cholecystitis, which is the main concern in our case. All right. Now, lastly, monitoring the patient's temperature every hour isn't necessary for a case, but this is something that we can monitor according to protocol, maybe every 4 hours, and that would be more appropriate. But hourly, it seems unrealistic for this situation. Now, let's move on into our next question, number 2. A 46-year-old client is scheduled for an outpatient ultrasound of the gallbladder. Which piece of information from the nurse's assessment suggests that the test might need to be postponed? A, the client used a laxative the night before. B, the client ate a meal high in fat the previous night. C, the client has a permanent gastrostomy tube. D, the client consumed a low-fat bagel 4 hours prior to the test. So your patient is scheduled to have the ultrasound of the gallbladder. So which piece of information stated in the options that may be the reason that this test may be postponed? Okay. So the correct answer here is letter D. That's the client consumed a low-fat bagel 4 hours prior to the test, because we know that eating food within 4 hours of the ultrasound can cause the gallbladder to contract, and this will interfere the accurate study, and also the patient should remain nothing by mouth for at least 8 to 12 hours before this test in order for us to have a much more accurate results. So think about NPO for about 8 to 12 hours. And if the patient had ingested any food items, then this can also lead to the gallbladder to contract. All right. Now, why not letter A? The client used a laxative the night before. this doesn't really impact the results of the gallbladder ultrasound. And if you selected letter B, the client ate a meal high in fat that previous night, it would not affect the ultrasound as long as the client was NPO on the day of the test. At least that requirement of NPO status about 8 to 12 hours. And then lastly, the client consumed a the letter C rather, the client has a permanent gastrostomy tube. This does not interfere with the ultrasound study of the gallbladder. All right, so I hope that you got this test question correctly. Let's have number 3. What are the factors linked to the development of acalculous cholecystitis? Select all that apply. A, fasting. B, hypothyroidism. C, parenteral nutrition. D, extended immobility. E, streptococcus pneumoniae infection. F, lack of bile in the intestines. So these are, you're going to look for those factors that can contribute to the development of an acalculous cholecystitis. So the correct answers here are letters A, C, and D. This is something that can occur whenever the patient probably is fasting, or if they have been immobile for an extended time, and also if they had been using or receiving total parenteral nutrition for a while as well. Now, these factors actually can reduce the gallbladder motility, and this can make the outflow of the bile much slower, so it will tend to cause the formation of that sludge. Okay, so this will contribute to the inflammation of the gallbladder without the presence of stones. Okay, so take note about those items. So we got A, C, and D. Why not letter B, hypothyroidism? This is not something that is recognized as a risk factor or a factor to acalculous cholecystitis. Letter E, streptococcus pneumoniae infection. This is unrelated to acalculous cholecystitis as well. And letter F, the lack of bile in the intestines, is not directly the cause of this condition. Now let's have our next test item. Number 4, what should the nurse anticipate as part of a care plan for a patient after laparoscopic cholecystectomy? A, returning to work in 2 to 3 weeks. B, a 3 to 5 day hospital stay post-surgery. C, placement of a T-tube in the bile duct to aid bile drainage. D, small abdominal incisions covered with small dressings. The correct answer here is letter D, because after a laparoscopic cholecystectomy, the patient is expected to have 1 to 4 small incisions, and these are typically covered with small dressings. We call them Steri-strips to protect the area. And this is a minimally invasive procedure that will also allow quicker recovery for a patient with the acute cholecystitis. Now, if you selected letter A, returning to work in 2 to 3 weeks, we know that most patients can return to work within a week following a laparoscopic procedure. 2 to 3 weeks is a little bit more. That's kind of extended, so that's incorrect. Now, what about letter B, 3 to 5 day hospital stay post-surgery? Well, a hospital stay is usually not necessary, or it is actually limited to 1 day for a lap cholecystectomy. This is quite different to the traditional type of incisional cholecystectomy. All right, so that will involve a larger incision into the abdomen, which can actually require longer periods of recovery. Now, if you selected letter C, placement of a T-tube in the bile duct to aid bile drainage, this is something that you're going to expect in an open cholecystectomy when the bile duct exploration was needed, but not for a laparoscopic procedure. Okay. Let's take number 5 this time. How should the nurse manage a T-tube for a patient following a cholecystectomy? A. Ensure the tube is supported and free from kinks. B. Connect the tube to low continuous suction. C. Clamp the tube when the patient is ambulating. D. Flush the tube with 10 ml of sterile saline every 2 to 4 hours. The correct answer here is letter A. Ensure the tube is supported and free from kinks. This will ensure that the bile can drain into the collection bag by gravity, and this will prevent the bile from backing up into the liver, and this will also reduce the risk of the complications. Now, if you selected letter B, the T-tube does not require suction. It drains bile via gravity. If you selected letter C, clamp the tube when the patient is ambulating, it's not recommended unless it's ordered by the healthcare provider. If you selected letter D, flush the tube with 10 ml of sterile saline every 2 to 4 hours. The irrigation of the T-tube is not a standard practice unless it is specifically ordered. Again, our correct answer here is letter A. Number 6. What discharge teaching should the nurse provide to a patient after a laparoscopic cholecystectomy? A. Keep the surgical site clean and dry for at least 1 week. B. Report if you need to take pain medication for shoulder discomfort. C. Report any drainage that is bile-colored or appears purulent from the incision sites. D. Expect some nausea and vomiting for a few days post-surgery. The correct answer here is letter C. If you notice any drainage or anything that is bile-colored, or if it's purulent that is present in the incision site, this can indicate that there is infection or there's leakage of the bile, and this is something that you should urgently report to the medical provider. This is a post-op complication to laparoscopic cholecystectomy. All right. If you selected letter A, the bandages can be removed the day after the surgery, and the patient can shower. So keeping the site for a week is unnecessary. If you selected letter B, report if you need to take pain medication for shoulder discomfort. This is a common occurrence after laparoscopic surgery because of the gas that is used during the surgical procedure, but it does not need to be reported unless it becomes more severe or it is persistent. Okay. Now, if you selected letter D, nausea and vomiting are not expected, and these two may suggest that there is also a complication. So this should be reported. Alrighty. Let's move into our next test question, number 7. What intervention is most effective in preventing further gallbladder stimulation in a patient with acute cholecystitis? A. NPO with nasogastric suction. B. Incisional cholecystectomy. C. Administering antiemetics. And D. Administering anticholinergics. We are being asked about that nursing action that is most effective in preventing further gallbladder stimulation. The correct answer here, it is letter A. We need to keep the patient nothing by mouth, and also the possibility of using the NG suction to prevent the gallbladder from being stimulated by food or fluids entering the GI tract. And again, this is to rest the gallbladder, which is actually a smooth muscle. All right. So with that, this will minimize the pain and also minimize the patient's inflammation. If you selected letter B, incisional cholecystectomy, yeah, that's the incisional cholecystectomy, which is basically the traditional type of surgical procedure. This removes the gallbladder, but does not directly address the stimulation during the acute phase. So we really need to allow the gallbladder to rest first. Okay. Now, what about letter C, administering antiemetics? These medications can control the nausea, the vomiting, but these will not prevent the stimulation of the gallbladder. And if you answered option D, these anticholinergics can reduce the smooth muscle spasms, specifically in the bile ducts, which can actually decrease the pain, but these do not prevent the gallbladder stimulation as well. Okay, so let's go back into that NPO and with the use of the nasogastric tube suction. Alrighty, I hope that you got that question correctly. All right, for those who just joined us, welcome. We are halfway to our Q&As. Let's have our next item, number 8. A patient with a history of chronic cholecystitis asks whether they need to continue following a low-fat diet after having a cholecystectomy. What is the nurse's best response? A, continuing a low-fat diet will prevent the development of more gallstones, so you should follow it. B, since the removal of the gallbladder means you won't be able to process fats effectively anymore. C, a low-fat diet is generally recommended for a few weeks after surgery until your body adjusts. D, after your gallbladder is removed, you can eat anything as your pain won't be triggered by fat anymore. So what would be your best response? The correct answer here is letter C. Because after the gallbladder is removed, the bile can now flow directly from the liver into the intestine. So generally, it's advisable to follow a low-fat diet temporarily, okay, until the digestive tract adapts to this change. And most of the patients can actually tolerate the moderate fat intake after this period, but large amounts of fat probably could cause some digestive issues. So they can tolerate moderate intake of fat after the procedure. Now, if you selected letter A, continuing a low-fat diet, well, we know that after the gallbladder is removed, their new gallstones will not form. So this is incorrect. Now, if you selected letter B, we know that fat digestion can be temporarily affected, but the body can adjust over time, and the body can handle moderate fat intake. Okay. Now, if you select the letter D, we know that patient may have fewer symptoms related to fat intake, but a sudden shift to a high-fat diet could still cause digestive discomfort after a surgery. So this is a false statement. You can eat anything as your pain won't be triggered by fat anymore. Okay. So again, like I've said, moderate fat intake is something that can be easily tolerated after the removal of the gallbladder. Let's have number 9. What assessment findings should the nurse prioritize when communicating with a healthcare provider about a patient with acute cholecystitis? A, bright yellow urine. B, tan-colored stools. C, increased pain after meals. D, complaints of frequent heartburn. You got to prioritize here the manifestation. The correct answer here is letter B. That is tan-colored stools. This is suggesting that there is a potential obstruction of the bile duct, which is a serious complication that will require immediate attention. So this is a common finding that really is urgent, and this is a typical manifestation of the acute cholecystitis. However, if you selected letter A, bright yellow urine, this is not unusual and does not suggest a critical condition. Now, if you selected letter C, increased pain after meals, this is an expected finding in acute cholecystitis. It doesn't really indicate an emergency. However, if you selected letter D, complaints of frequent heartburn, this is something that may occur with other gastrointestinal issues, but it's not a priority in this situation. Okay, again, that is letter B, tan colored stools. That signifies that there is a blockage in the bile duct. Number 10, what assessment findings should the nurse prioritize when communicating with a healthcare provider about a patient with acute cholecystitis? A, it's normal to see yellow-green discharge from the incision site for a few days. B, I can take off the bandages tomorrow and shower. C, I'll need to avoid strenuous activities and work for about a month. And D, I will need to follow a low-fat diet for the rest of my life. And this is a question that is quite similar from what we just had. The correct answer here is letter B, because after cholecystectomy, specifically the laparoscopic type, the patient can typically remove the bandages and shower within 24 hours. And the small incisions that are used as entry points for the instrumentation, these can heal quickly, and there are minimal restrictions on daily activities after this procedure. Now, if you selected letter A, it's normal to see yellow-green discharge from the insertion site or incision site. This is incorrect. This is a sign of leakage, and this is something that you should report right away. If you selected letter C, I'll need to avoid strenuous activities and work for about a month. This is something that you should be including or in teaching a patient that may have the traditional type of a cholecystectomy. The patient with a lap cholecystectomy can resume to normal activities, including work, within a week, not 4 to 6 weeks. If you selected letter D, I will need to follow a low-fat diet. This is unnecessary, especially it's stated for the rest of my life. There's going to be some modification of their diet, which is typically recommended only for a few weeks, not for the rest of their lives. Let's have number 11. A patient is admitted with severe abdominal pain, nausea, and vomiting due to cholecystitis from gallstones. What is the nurse's priority action? A, manage anxiety. B, rehydrate the patient. C, provide pain relief. D, address nutritional deficiencies. Your patient is having severe abdominal pain, nausea, vomiting due to cholecystitis from gallstones. Which of these 4 options is something that you can resolve right there and then? That is letter C, provide pain relief. We need to manage their severe pain, and this is the top priority because this is associated with a biliary spasm. So you got to provide or administer that analgesic prescribed. So this can also lessen or alleviate the nausea and the vomiting. So when you are addressing the pain first, this will also reduce the occurrence of the complications like dehydration and fluid loss or electrolyte loss. Now, if you selected letter A, manage anxiety, this is important, but this is secondary to the pain control. If you selected letter B, rehydrate the patient, this is something that is necessary, but we need to control the pain first. This will have a much more immediate impact on the comfort and overall well-being of the patient. Now, letter D, address nutritional deficiencies. This is a concern, but not in the acute phase. We got to stabilize first our patient by controlling their pain. Let's have our next question, number 12. A patient has just undergone a laparoscopic cholecystectomy. Which discharge instruction should the nurse include? A. Drain the bile bag every day. B. Use a paper bag to breathe deeply if feeling nauseated. C. Keep the dressings in place for 6 weeks. And D. Notify the healthcare provider if any incision shows bile-colored drainage. Again, we're back to this. The correct answer here is letter D. Okay. There should be no bile-colored discharge from the incision sites after a lap cholecystectomy. If you're going to see it, this is a complication. It is leakage of the bile drainage. You got to notify the medical provider or the surgeon right away. For letter A, drain the bile bag every day. With the lap cholecystectomy, it doesn't involve the use of a bile bag. This is something that you will expect in a patient that has that T-tube placement, okay? Especially if there is presence of gallstones. Letter B, use a paper bag to breathe deeply if feeling nauseated. This is something that may help prevent fainting due to the hyperventilation, but it will not treat the nausea. If you selected the letter C, keep the dressings in place for 6 weeks. Well, this is incorrect. The patient usually will have those dressings removed within the, it's going to be removed within the first 7 days. Okay, usually the doctor or the surgeon will remove that, not after the 6 weeks. All right. Now let's have our next question, number 13. A patient's stool is light gray in color. What should the nurse further assess for? Select all that apply. A, sensitivity to fatty foods. B, fever. C, yellowing of the skin or eyes. D, difficulty breathing. E, pain in the lower right abdomen. Or F, history of peptic ulcer disease. The correct answers are letters A, B, and C. So the light gray color in the stool, this suggests that there is a lack of the bile. And this is the result from the bile duct blockage. So the stool will lack that pigmentation or color. So the other manifestations, this can include the intolerance to fatty foods, fever, also infection or inflammation, and jaundice from the elevation of the bilirubin levels. So those are our items A, B, and C. If you selected letter D, difficulty of breathing, respiratory issues are not usually common in a gallbladder or bile duct problems. If you selected letter E, this is indicative of appendicitis, not gallbladder inflammation or bile duct issues. If you selected letter F, history of peptic ulcer disease, well, this is something that would not cause the stools to become light gray. Okay, that's totally incorrect. Okay. What you will find in a peptic ulcer disease probably would be a dark tarry stools because of a possible bleed from the erosions and the GI lining. Let's move on to our next question, number 14. A patient has had an open cholecystectomy with exploration of the bile ducts. A T-tube was inserted. How should the nurse evaluate its effectiveness? A, flush the T-tube with 20 mL of saline every 4 hours. B, unclamp and drain the T-tube contents daily. C, check the color and amount of drainage during each shift. And D, observe the incisions for bile leakage. We are being asked to evaluate for the effectiveness of the T-tube. The correct answer here is letter C. Because we know that monitoring the color and the amount of the bile drainage from the T-tube, this will ensure that the bile duct remains open and that the T-tube is functioning properly. So the drainage should be dark green or could be gold in color. And so if there's any unusual changes, this should be reported. Now again, if you selected letter A, flush the T-tube with 20 mL of saline every 4 hours. This is not recommended unless specifically ordered by the medical provider. If you selected letter B, unclamp and drain the T-tube contents daily, well, this T-tube basically is left unclamped, especially in the early post-op period, to allow a continuous drainage. And this is something that's not drained once a day. This should have been allowed to drain continuously. There should be no clamping. So if they stated unclamp, well, that's not a good sign right there. Letter D, observe the incisions for bile leakage. We know that in an open cholecystectomy, there is usually only one large incision that will be made. And if there is any bile leakage from it, this can indicate that a complication has already happened, but it is not the primary method of assessing the T-tube effectiveness. All right, let's move on. Number 15. A patient with cholecystitis continues to experience severe pain in the right upper quadrant of the abdomen. The patient's vital signs include a temperature of 38.4 degrees Celsius, pulse 112, respirations 24, blood pressure 140/92. Using the ASVAR communication method, what should the nurse recommend to the healthcare provider? A, administer IV hydromorphone. B, prescribe oral diltiazem. C, administer IM meperidine. And D, give IM promethazine. The correct answer here is A, administer IV hydromorphone. This is a potent analgesic. It's an opioid. And this is a medication that works quickly and appropriate for a severe pain in this scenario. So if you're administering this intravenously, this is really gonna ensure a much better control of the pain, okay? Because our patients' vital signs are already out of whack. Look at all those elevated blood pressure, respirations 24, pulse rate of 112. These are signs of sympathetic stimulation caused by the pain. If you selected letter A, or letter B rather, prescribe oral diltiazem. This is a drug that is a calcium channel blocker. This is something that's used for heart issues, not for pain relief. So it's not going to be appropriate. If you selected letter C, administer IM meperidine. This is a drug that is no longer preferred because of its risk of seizures and also toxic metabolites. And IM administration is going to provide a delay in the delivery of pain control, okay, compared to the IV hydromorphone. So you might have noticed this, meperidine, this is the drug of choice. In the previous years, you probably have seen this in the older NCLEX reviewers, that meperidine is the drug of choice in controlling the cholecystitis pain, because it doesn't really, it doesn't really cause a lot of spasm of the sphincter of Oddi, but this has already been disproven. And so with the adverse effect, which is the seizure because of the toxic metabolites, this medication is no longer recommended, okay? And if you selected letter D, give IM promethazine. This is something that can treat the nausea, but it will not address the severe pain that our patient is experiencing. So let's go back to addressing the patient's severe abdominal pain, okay? Let's have number 16, and this will be our last test item of the day. After a laparoscopic cholecystectomy, what dietary advice should the nurse provide to the patient for the immediate post-operative period. A, do not eat or drink anything for 24 hours. B, you can return to your normal diet tomorrow. C, start with liquids today and eat light meals for the next few days. D, begin with liquids and transition to a bland diet as tolerated. The correct answer here is letter C. Because after the surgery, the patient should start with liquids and will gradually progress to the light meals. And patients typically are now able to tolerate the diet the day after the surgery without any issues. However, though, maybe normal or heavy meal may cause some discomfort. So you're going to have to slowly progress the patient's diet from being clear liquid to a full liquid, and you're going to do this as long as the patient is tolerating. Okay. If you selected letter A, do not eat or drink anything for after 24 hours. There is no need for us to do that to avoid all food and drinks. We can introduce the liquids shortly after the surgery, and of course after they have the gag reflex, right? Letter B, you can return to your normal diet tomorrow. This is a bit too soon, premature. This can lead to discomfort and also digestive issues. If you selected letter D, there is no specific need for a bland diet after a lap cholecystectomy. However, what we want to really avoid is a large fatty meal in the first few days. All right, so I hope that you have learned something from our presentation today. And please don't forget to like and subscribe to this channel if you have not done yet. And I hope to see you soon again in the next session for more concepts. So again, I'll see you again. Thank you for your time.